Hi, this is Archie, and I am 2 years on T, and I am 6 months post-op surgery. Um, okay, so changes in the past year or so obviously have slowed down. I don't think my voice has changed at all anymore, but I've gotten a lot more facial hair. Um, yeah, hair's been the big one. Um, you probably can't tell, but it's pretty much all along here. It's all connected, apart from mustache isn't connected down. Yeah, it's mainly all on my neck, but I'm very happy with it. What else has changed? I've recently started swimming, and like trying to go twice a week, so I'm starting to get better muscles. I actually was worried that my chest was swollen the other day. I thought something was going wrong, but no. Turns out I'm just gaining a bit of muscle mass, and I'm so not used to it. So yeah, that's something I'm really happy about. What else is going on? Another change that I've noticed more recently is that my hair feels like thicker, like coarser. Um, so I don't know whether it is thicker or whether I have more of it or whether it's just the textures change. But yeah, it's definitely noticeably like just tougher. Um, I think I've got more of a male hairline. I can't really tell because I haven't really looked at any photos. And plus, I've obviously got a much shorter haircut these days than pre-T, so it's kind of hard to tell what my hairline actually used to be. Um, but yeah, I'm pretty sure it's getting there, so I'm pretty happy with it. I'd say I passed 100% at the time. I think the last time I was misgendered was coming up to a year ago now. So that's amazing. Um, yeah, couldn't be happier about that. Really happy with every single change that's happened. In other news, I had my second appointment at Charing Cross, which was an odd experience because it was only my second appointment, and I'm rocking up 2 years on T and 6 months post-op. Yeah, it felt weird. But it was a really good appointment. I feel really positive about like next stuff. So I definitely want a hysterectomy. That's really important to me, for various reasons, and mainly medical, to be quite honest. I think it'd just be like one less worry, one less thing to think about. Yeah. So the question on my mind was whether to get metoidoplasty done and so wait and get it done together, so less recovery time, get it all done at the same time, or just go for the histo, because I'm kind of unsure if I want the meta. So I went to the appointment yesterday, a bit apprehensive, but yeah, my doctor, I had Dr. Andrew Davies, I think is his name. He was really helpful. So he's booking me in for just an assessment, really, with the surgeon that does the meta stuff, just to see what's what my options are. Yeah, so I can just get a better picture. So it's an unofficial referral. I couldn't go on and like have my surgery right away if I decided that's what I wanted after this appointment. I still need to see another doctor at Charing Cross before I can be referred for that. So yeah, no, I feel really positive. Feel like taking the right steps, just to figuring out if I want anything else or whether I'm good. Because I've been feeling so positive lately, like just everything just seems to be going right. Um, it's just mad how far I've come. Like, I think I celebrated my 2-year anniversary with my best pal, and it was a Thursday night, so it was a cool night, and we went for a nice meal and got wrecked. I just really celebrated, and it was fantastic. And it's nice to look back, because it has been a tough journey, and there are points, particularly when you're very early on, that getting better just seems so far away. But I'm here, and it's amazing, and it's just as amazing as I thought it would be. And I'm just see everything in a positive way. It's really great. For me, I think it's really important to celebrate some form of event around your transition. I think it's important to just be really happy about some event. It doesn't have to be tea, because obviously you could be pre-tea or not want tea or can't have it, but some sort of significant date. I think it's important to celebrate it, because when it comes around, you'll remember that you have come far, and I just felt just excited about where I was at and where I was going. And it's something special for trans people. It's our thing alone, it's like a second birthday. So yeah, I think it's just important to really be around people you love, just have a day for you to just embrace everything you've done. And yeah, that day meant a lot to me, and it's nice to share it with people who get it as well, that understand why it's important. And so I guess I should show off the nips. So I've scarred quite badly, but I'm not too fussed about it. I think it will go down. I just think my body just scars easily, and that was just how it was going to be. So so yeah, this is what I look like 6 months post-op. So yeah, scars flick up. It's stretched a lot there because I've got quite an active job. I knew it was going to stretch. There was only so much I could not reach up and do things like that. So yeah, but I knew it was going to happen, so I guess I just felt prepared, and I'm really not bothered, because I do know that in a couple of years' time these scars they're gonna have died down so much that you won't even be able to tell whether they've stretched or not. They're quite, I think it's called keloidy, they're quite raised. That's this side. That one flicks up more. I assume that was because I was bigger on one side a little bit. I assume the curve just had to go a bit differently. But my nipples are looking good. I can sort of feel through them, which is a bit odd. They're not completely numb. They just feel a bit weird. I've still got quite a few numb areas, mainly around here, my back. That is still numb, like this whole chunk there, which is weird, and it's the same on this side, but not as much. So yeah, and yeah, around there. You can't really see the drain marks at all. I don't think you see them all here. It's there, one there, and one there, and I only know it's there just because you can feel the tiniest little bump, like a freckle or something. So yeah, I'm really chuffed that I went with Victoria Rose. I think she did a great job. I think I look pretty even. And yeah, I think I just need to wait for the pinkness to go away, and I'll be sorted. I always wondered what my chest hair pattern would look like afterwards. You can't tell that I have chest hair, but I do. And it is a bit weird. I've got a back patch here, and then I just have patches just directly underneath the nipples. Obviously, where obviously nipple probably used to be just below this part of the skin, so it would have been around that. So I think I'm just gonna have very hairy under nipples, which is a bit weird. So yeah, when I assume I'm probably going to get more chest hair. I think that hasn't stopped. It does seem to be increasing because I'm still getting more leg hair, more hair everywhere. So I assume that will carry on, and I think it'll look a bit interesting because I have just no hair underneath the scars, so it's very much just and stops. But yeah, so this is good. So I think that's all I have to say. I have no idea when I'll do another update. Maybe after my assessment with the meta guy. Maybe in a year. I don't know. But I'm in a good place. So yeah, until next time.